Imagine waking up one morning and feeling like the world around you is just a little out of reach. A familiar name slips away. A conversation from yesterday feels hazy. A simple appointment disappears from your mind as if it never existed. These moments can feel scary, but they're also more common than you might think. Today, we're going to understand memory loss, what it really is, why it happens, and when it becomes something to take seriously. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCPUK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. Memory loss doesn't just mean forgetting things. It means losing the ability to recall information that you could once remember easily. It can be temporary or permanent. It can happen suddenly or gradually over years. And it happens because many parts of the brain must work together to create, store, and retrieve memories. And when even one part isn't functioning well, memory begins to slip. Not every small lapse is a sign of illness. Taking longer to remember something can be a normal part of aging. Stress, poor sleep, distraction, and emotional strain can all interfere with recall. But true memory loss is different, because even with time, hints, or reminders, the information simply isn't there. There are two main patterns. Acute memory loss, often called amnesia, appears suddenly, usually due to an illness, injury, or event that disrupts brain function. Progressive memory loss develops slowly over time and can be one of the earliest signs of conditions like mild cognitive impairment or dementia. So, what are the earliest signs? Repeating the same questions, forgetting recent conversations, losing familiar items, missing appointments or bills. These become more concerning when they appear alongside difficulty finding words, trouble completing routine tasks, not recognizing familiar faces, or struggling with planning and concentration. Many different conditions can cause memory loss. Sudden memory loss may follow a head injury, stroke, aneurysm, brain surgery, severe infection, carbon monoxide poisoning, seizures, medication effects, alcohol-related blackouts, or trauma. Gradual memory loss often comes from degenerative conditions like Alzheimer's disease, dementia with Lewy bodies, Huntington's disease, or vascular disorders of the brain tumors, multiple sclerosis, sleep problems, depression, and uncontrolled chronic illnesses can also mimic or worsen memory problems. So, how is memory loss treated? Right now, there is no direct cure for memory loss itself. The key is identifying and treating the underlying cause and giving the brain the best chance to heal. Sudden memory loss always requires urgent medical attention. Progressive memory loss should be evaluated as early as possible so treatment can begin in time. At home, the focus is on support. Using calendars, planners, alarms, smartphone apps, or notebooks doesn't weaken your memory, it strengthens it. Staying socially active keeps the brain stimulated. Physical activity boosts blood flow to the brain. Curiosity, learning new skills, puzzles, hobbies, and mental challenges all keep neural connections alive. Ignoring memory loss can have consequences. Acute causes like stroke, infections, or head injury can become permanent if not treated quickly. Progressive causes may also worsen faster without early diagnosis. Can memory loss be prevented? Not always, but some causes, especially amnesia, are preventable. Wearing helmets and seatbelts, managing blood pressure, diabetes, and epilepsy, treating mental health concerns like depression, maintaining a healthy weight, avoiding non-medical drug use, limiting alcohol, treating infections early, taking medications exactly as prescribed. These steps protect both brain and body. When should someone see a doctor? Sudden memory loss is always an emergency. Progressive memory loss should be evaluated as soon as it becomes noticeable, even if the symptoms are subtle. Early recognition helps individuals plan ahead, receive treatment, and maintain independence for as long as possible. And there's one more important question. Can emotions affect memory? Yes. Depression, anxiety, and even long-term emotional suppression can disrupt the brain's ability to process and store information. That's why emotional health is just as important as physical health in protecting memory. Here's the truth: memory loss can be frightening, for both the person experiencing it and the people who love them. But talking about it early, with kindness and honesty, can make an enormous difference. It can guide treatment, it can protect safety, and it can help families support each other with understanding and dignity. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.